So I grew up on a farm. I went to school in Champion and graduated high school in Vulcan. So this has always been home. So it was my local optometrist that at first found this freckle or lesion on my eye. But since then, I've been having to travel to the Rockyview Hospital in Calgary. I can't count the number of trips we have made to the city in the last few months, just to meet with the doctors and the specialists. Had both of the surgeries been in Edmonton, we would have had to leave and probably go spend 5 days there, which is 5 days in hotels. And I would have had to find someone to take my kids for probably 6 days.
So we've had the eye brachytherapy program in Alberta since 2011. And it's been an immense success where we were able to save over 90% of eyes with melanoma, whereas before we had to ship people to Toronto or Philadelphia, and about 50% of eyes we had to remove because of challenges receiving treatment from far. We were only able to treat patients in Edmonton for the first while, and so the Southern Alberta patients didn't have the same access to care. And we were seeing that more of the Southern Alberta patients were having their eyes removed and severe vision loss compared to the Northern Alberta patients. So the initiative was to create a program in Calgary for the Southern Alberta patients, and that's what we've started recently in 2024. Inside the eye is a melanoma, and what we want to do is treat the melanoma with the most accurate method of delivering radiation. So brachytherapy means we create a custom-made implant made out of gold, and we use radioactive iodine on one side of it, and we put the patients to sleep and we attach it to the outside wall of the eyeball right next to the tumor. And it stays there for 4 to 7 days, and then we remove it at just the right time so they get the perfect dose to kill the tumor and minimize vision loss. The Alberta Cancer Care team and the team at the Tom Baker Cancer Centre, working alongside the Cross Cancer Institute, have worked so hard to bring this program to Calgary, which is going to reduce wait times, it's going to save eyes, it's going to save lives.
I feel so lucky. Like that first day, we just left from home the first day and was able to be back home within the same 12 hours. And I hope they continue to be able to do both the surgeries there just to serve a greater area.